And in that article, she talks about telemedicine unreadiness. She talked about a number of options to connect older, disconnected health consumers, including leveraging their televisions, the voice tech digital assistants like Amazon Alexa, adapting FaceTime and Skype type calls. She also talks about for people over 65 who experienced a virtual care visit during the pandemic, just how those numbers on a number of metrics were so much higher than they would have been in 19 in terms of their interest in their adoption. So that is worth looking at. And she closes on, while we're still in the midst of battling the coronavirus, which is hitting older people in America especially hard, Orlov's report gives us a hopeful roadmap to rebuilding care in a better, safer, more cost-effective, humane setting, our homes.
Yep.
Many building blocks of the technologies and applications are available now. Analytics and virtual reality and augmented reality are evolving, spurred on by the public health crisis. So I will at some point read the full report. I'm definitely interested in this area, but wanted to share that much. What were your thoughts on that?
Yeah, I appreciate you sharing this resource. I scanned the report. There's a couple of things that jumped out.
Okay.
They talk about loneliness and isolation, which I think is an epidemic in America, not only among the aging population, but also, quite frankly, I just think it's an epidemic in general. I run into people all the time and just try to have conversations and figure out who their net is, who the people they talk to when they have a challenge or a problem. And a lot of people just do not have, the older they get, you just surprised at the fact that they don't have best friends and they don't have friends. And you're just sort of, and this epidemic, this pandemic did not help that in any way. She has some numbers. October 2018, 34% felt a lack of companionship. In June of 2020, 41%, 27% felt isolated from others. In October of 2018, 56% in June of this year. 28% had infrequent social contact, 46% this year. And, that's the situation my parents are living through right now. They're pretty well isolated. They are being good citizens. They are taking care of themselves. They, did Christmas via, it wasn't Skype. It was probably Zoom if I thought about it. And, all those things are hard for them. They did not go to the place they normally do. And anyway, when you're talking about the aging, that's one of the things. All right, so we connect them through digital. And this research does a great job in sort of pointing out some of the challenges we had bringing that population in. And it was, as you mentioned, the fact that in some areas, the bandwidth just wasn't there. In some areas, it's training and helping them to make those connections. The reality is during the pandemic, the policy foundation was changing as we went along. So health systems were adapting and we just didn't have things that were baked, easy, that they were used to. And I really love this research. I mean, it talks about this growing, what they call elder orphans that leads to even greater risk of isolation. This is a really good report. I'll probably post this in some way in the show notes so people can reference it. It's really good.